Health experts say rise in vaccination rates are slowing infections across the country, most notably in California, once considered an epicenter of COVID cases. Now the state with the lowest coronavirus case rate in the country. News Nation correspondent Nancy Liu live tonight in Santa Monica rather. Nancy, what's believed to be responsible for the drop in cases?
Well, Aaron, health officials credit mitigation efforts, but also one of the highest vaccination rates in the country of about 60%, and more than 80% have had at least one shot. But experts stress the pandemic is hardly over and winter is coming. Tonight, the number of COVID patients in California hospitals is down by about a third. The summer surge due to Delta appears to be over.
It's great that we're seeing cases go down, but even more important than cases going down, we're seeing hospitalizations and deaths go down as well.
According to CDC data, California is the only state with a 7-day case rate below 100 per 100,000. West Virginia has the worst rate of infection with more than 715 cases per 100,000. That prompted this recent plea from Governor Jim Justice.
We're going to run to the fire and get vaccinated right now, or we're going to pile the body bags up.
The situation also remains dire just north of California in Oregon. ICUs are full and ambulance backups are common. Ditto in Tennessee.
I tried to fight through it as much as I could, as much as I can, because I know that somewhere out there's somebody else that needs this bed desperately.
In California, doctors credit health officials for being proactive as well as reactive. Many communities have reimposed an indoor mask mandate regardless of vaccination status. And vaccination is required in many workplaces, including healthcare facilities. Mandates are also in place at schools, with LA County requiring all students over 12 to be vaccinated by January. But even here, vaccine holdouts have experts fearing another surging mutation.
What we're concerned about is that the circulating virus may be resistant to vaccines and may be more deadly. And then we're really right back where we started in March of 2020.
California's improved COVID situation has actually led to a shortage of monoclonal antibodies here. That is the treatment known to prevent critical illness in COVID patients. However, HHS is sending higher rations to the hard-hit areas such as West Virginia and Kentucky.